COVID-19 has been linked to an increased risk of heart attacks and other cardiovascular events, even in individuals who experienced mild or asymptomatic infections. Studies have shown that individuals who contract COVID-19 face an elevated risk of these events for up to 3 years after infection. COVID-19 vaccine is consistently showing to decrease the risk of cardiovascular complications. COVID-19 vaccine is like a raincoat which protects you and shelters you. You could be a little wet, but not soaked. Likewise, COVID-19 vaccine decreases the severity of disease. It decreases the chance of you acquiring COVID-19. It prevents hospitalizations. It definitely decreases the risk of death. Research suggests that the virus can cause inflammation in the blood vessels, contributing to clot formation and increasing the likelihood of heart attacks. COVID-19 can also directly impact the heart by causing myocarditis, which is inflammation of the heart muscle. The rise in heart attacks could be tied to the virus's direct effects on the heart and blood vessels, pandemic-related stressors such as financial pressures and increased anxiety, inflammation and stress caused by the virus. There was a 29.9% increase in heart attack deaths among younger adults ages 25 to 44 during the pandemic. Individuals post-COVID infection have experienced a doubling of cardiovascular events like heart attacks and strokes. Heart attack deaths increased by 14% in the first year of the pandemic. During the pandemic, there was a 19.6% increase in heart attack deaths for people aged 45 to 64, and a 13.7% increase for those over 65. COVID-19 increases the risk of major cardiovascular events, like heart attacks and strokes, by up to 4 times in hospitalized patients. The findings highlight the need for ongoing cardiovascular monitoring for people recovering from COVID-19, even if their initial infection was mild. This is because long-term risks persist for up to 3 years after infection and include a near doubling of heart attacks and strokes. Cardiovascular screenings can detect early signs of heart problems. Pre-existing conditions. Individuals with pre-existing heart conditions or hypertension face even greater cardiovascular risks after contracting COVID-19. Hypertension more than doubles the risk of hospitalization with COVID-19. Blood type. People with certain blood types, particularly non-O types, face greater cardiovascular risks after infection. Those with AB or AB blood types have a higher cardiovascular risk post-COVID. Early intervention, monitoring, and lifestyle changes can help mitigate the risks of heart attack after recovering from COVID-19. Some suggestions include scheduling a cardiovascular screening, managing stress, maintaining a healthy lifestyle, seeking medical advice when needed, implementing public health messaging to emphasize heart health vigilance during COVID-19 waves, and establishing nationwide post-COVID clinics focusing on heart health and rehabilitation. There is a strong connection between COVID-19 infection and an increased risk of heart attacks. This risk is present even in individuals who only experience mild symptoms and can last for years after the initial infection. Ongoing cardiovascular monitoring and intervention, particularly for those with pre-existing conditions, are essential to mitigating this risk. If you watch this video so far, I am very sure that you will like this playlist on COVID-19. Share and subscribe to our channel Kundlas MD. I will see you in future videos.